Hello and welcome to We Can Learn to Learn blog. My name is Mina Roustayi and I am an integrative learning specialist who is dedicated to expanding awareness and expertise on how to optimize learning in education, particularly in public schools. Critical for success in school and in life is the ability to speak, to express thoughts, and communicate with others. However, research shows that excessive stress can temporarily lower our IQ and affect speech circuits in our brains. Given our tumultuous times, what can we do about the effects of rampant fear and stress that can limit learning, impact our health, and quality of life? I asked Heleen Grooten for another interview because she is a Dutch speech-language pathologist and pioneer of the Polyvagal Perspective, the science of safety, with great success in her work. You may be surprised at how basic and humanist her approach is, and that it is also a mindset that we can all adopt in our lives and professions. Among the many symptoms discussed, I had a chance to ask Heleen about apraxia, a neurological condition and diagnosis for individuals who want to speak, can make the oral movements to speak, and yet are unable to do so on command. I hope this interview inspires the realization of the life-changing potential of the polyvagal perspective to alleviate speech-language challenges. Heleen reports her experience that over time, safety has sparked ease and body-mind awareness in her clients. As they feel more settled and gain insight into their body sensations as potentially unresolved experiences, they slowly regain their inherent ability and desire to communicate and connect. I'm so delighted that we have a chance to expand our conversation.
I'd like to, yeah.
This is a really important conversation for me as an integrative learning specialist, because communication, you and I agree, is a human right, and everybody should be able to access it. Many individuals who have challenges communicating what they want to say, even from the point of view of having their voice come out, and they feel they've got tightness in their throat. In part one, we talked about how the polyvagal lens provides us with insights that really allow us to see that it's not like a muscle that needs to be surgically adjusted, but that it is a feeling of safety that allows people to be able to express themselves. In your experience, that's what you were telling us. And you also told us how you learned about the polyvagal theory and how it has changed your practice as a speech language provider with over 40 years of experience in the Netherlands, correct?
Yeah, that's right.
And so I thought that perhaps we could now talk about some general conditions that people come to you and they say, I can't say what I want to say, and I feel limited, and I'd like to improve what I need to do. We thought that we would conduct this conversation as an exchange of some of the things that I see and some of the things that you see.
Yeah, that
and
would be great. Yeah.
And how you handle it. Is there something you would like to start off with?
Yeah, what touches me is that you use the word safety. When you look at people coming to a practice because they have some problems or deviations, or as you say, they can't talk express themselves, there is a lump in the throat or it's blocked here. So people are anxious that there might be something wrong in their body, that there is really a problem. And the most people I do see were with an ENT doctor, and they told them there is nothing wrong with you, but they can't understand because they feel there's really something blocked in the throat or in their jaws or breathing. And then I start just coming them in, offering them a cup of tea and say, okay, let's have the time, and maybe you tell about your complaints. And what I do is trying to create an atmosphere of safety, so they feel that I'm really open to listen to them, and that we have all the time of the world, and that I'm really interested to hear what problems they have. And that I maybe also could ask, is there something that happened before your complaints start, and that there is space for that too. So it's not just medically addressed, but as human beings with each other talking about something that bothers the other one. And it's not that way that I'm their friend or their neighbor or their mother or whatever, but what I try to offer is a safe place, so everything that needs to be said to address the problem has space. Does it in a way resonates with your way of working?
There is this idea of there is something wrong with me.
Yeah.
And I am less than other people.
Yeah.
And when it comes to communication, it's so easy for others to think that a person is not smart enough or does not understand.
Yeah.
And so that in schools, as well in schools, I work with very young children, because I think my intervention at this age produces the most results from complications later on, both emotional and academic complications. And older individuals after high school, in college, and beyond, who then feel that there's such massive delay that they can never catch up, you know, and that produces a lot of anxiety and diminishes their ability to succeed.
Yeah.
And it really affects their sense of self.
Absolutely. Yeah.
Yeah.
So what you're telling, that people are focused on what they can't, so what's wrong with them, and what I try to look with them, what is working well, and are there circumstances in which you can express yourself maybe a little bit more easy. And that's why I want to create a safe environment, because when they feel at ease, maybe they can feel that their way of speaking calms down, or they feel heard and feel that they have the time to express themselves. And of course, when I ask when your way of speaking is not that much disturbed, when do you feel more at ease, and what's happening then to your complaint? Is it less? And they try to understand that and see that there might be moments in their life in which their complaint is less, and then we can try to analyze what situations you feel more at ease, and it works maybe a little bit better.
Right.
Then you realize you're just focused on whenever it's not going well.
Correct. Exactly. I also notice that there are certain cues in language that tell me how the individual perceives or what age they happen to be at the moment that they're talking to me. And that it's not always a constant. So for example, I might be working with a 23-year-old man, but there is a lot of, I don't know, I don't know, I don't know, I don't know. Every second word is, I don't know, right? And that tells me that there is such degree of lack of safety that he doesn't have any faith in anything that he says, right? Yep. So that it becomes an obstacle for him to perform in school.
Yeah.
And so one of the things that I do is I work to help him settle his nervous system.
Yeah.
Right? By slowing things down,
Yeah.
right? And by telling him about the polyvagal theory.
Yeah.
And when I tell him about the polyvagal theory, the main thing is for him to understand that there is no shame and that there's no blame. And what he is feeling right now is probably as a result of what happened to him,
That's,
the
yeah, absolutely
experiences
true.
that he had in the past.
Yeah.
Right? And so that's what I do from an educational point of view, which is my scope of work. How do you address it in your office with individuals and all those people that you train?
What I start to tell most of the time is that when you look at the autonomic nervous system, and I tell them that the autonomic nervous system really is so important that it depends maybe 80% of our reactions of who we are. So we are living in a society in which intelligence and thoughts or cognition is really, really important. And that I say that our body has a really good remembering of things that happened. So when there is a situation that might be equal as situations before in which you were anxious, your body remembers and acts the same way as it did before. So many people have an experience, you call that trauma, you call it a life event that was important. So what I try to do is create a place of safety, and I tell about the working, as I did last time, of the polyvagal theory, how it works, that there is a layer in us that can make us optimal as a human being, that you're feeling free to talk, feeling free to express yourself, your emotions, whatever. And when you're safe and you can connect with other people, that you're most healthy, you could say. But when you met things in your life that were maybe traumatic or heavy, or how you call it, the words doesn't matter for me at all, then you might have come in a survival state, and maybe one in which you get angry. We call this the state of the sympathetic nervous system, where you the fight flight is connected to that, and in which you maybe are angry or don't feel at ease, but you express it by movement, ADHD, that behavior like that. Or there is also another way of survival mechanism, the most old part of our nervous system, the dorsal vagal system, in which you try to hide yourself, not to express yourself so much. And that when you look from that perspective, it's totally logical that it's not easy to talk, because you felt maybe once in your life that threatened or whatever, that you tended to express yourself less, and then that it has a possibility that it was so important in your life that this mode of being in that state, the dorsal state in which you can't express, tends to come more often on the surface than maybe you like. But when you understand that this is just normal, that these patterns are there and that are diagnostically not seen by medical specialists or other therapists, but it's maybe possible that they are in that state, and that I can help them to relax in that state and to try to make the autonomic nervous system more resilient.
One of the things that I love about the polyvagal theory as applied to education and in speech language is that it recognizes the complexity of us as human beings.
Absolutely.
I tell the individuals, be sure to go see an ENT doctor. ENT is ear, nose, and throat specialist, to make sure that you know there's nothing structurally going on in your ear.
Absolutely.
There's nothing structurally going on in your nose. If you know, breathing from the point of view of breathing or nasal kind of speaking, or there's nothing structural wrong in your throat. What I find is that that with the polyvagal theory, we also talk about adverse childhood, conditions, experiences that, affect the autonomic nervous system. But we don't have to be psychologists or mental health workers.
Yeah.
Because I think that the polyvagal theory allows anybody from any profession to make a profound connection and ease communication by providing and recognizing where am I as a provider, where is the other person who is coming to ask for support, and then also recognizing that there is nothing for me to fix. It's just a way of, it's a dance. It's a dance of bringing about ease. And when we allow for an understanding of what everybody's nervous system has in common, right? Then it becomes so much easier for people to feel compassionate about themselves. Like,
and relax, not thinking there is something wrong with me, but I have a symptom, and maybe it's directed. You called it the adverse childhood experience. That when you had a really adverse childhood experience, that you're blocked from that moment, and you're not able to express yourself because things happened to you that were too heavy, too great. You were not understood or trusted by parents and others around you, and then there is something in your nervous system that tries to maybe help you, maybe to help you to survive, and that it's better than not to talk that much or to keep your mouth shut or to hide yourself. And people can start to understand that the nervous system helps you and remembers that when equal situations are there, the same way of acting could come up. And when you understand that, that's really important. And that there also is neuroplasticity in the brain, that we can help people to change their brains and their way of reacting on the world. But it needs time and trust and safety.
Exactly. Let's take an example and see how maybe we can look at the diagnostic label and then view it through the polyvagal lens. So apraxia, and I'm just going to read the definition. Apraxia is a neurological disorder characterized by the inability to perform learned, that is familiar movements on command, even though the command is understood and there is a willingness to perform the movement. Both desire and the capacity to move are present, but the person simply cannot execute the act.
Very interesting.
Yeah, so how would you work with someone who has this diagnosis? What would you?
I should think, when I listen to that, I can imagine from polyvagal perspective that someone is really in the dorsal vagal state. So in this state, the only thing for survival is to hide yourself, not express yourself. And what happens, it is not just the organs that are related to speaking and things like that, but it also impacts your heart. Your heart rate is slowing down, your breathing is slowing down, the muscle tension is really low. People have not that much muscle tension. What you see when you look to their mind, they're not completely here. What I do recognize is that many people have a form of dissociation, and dissociation is said in diagnostic terms of psychotherapy and psychiatry as a really huge problem. But when you go back to adverse childhood experience, as you told, you can imagine when things are too heavy and too great, people learned very young to go to a state when they're fantasizing, dreaming, making maybe small stories in their head and not being there as a survival mode. So people learn themselves that when it's too great and too heavy, not to be completely here. And they don't feel their body often, so not being able to move. I could imagine that it's really directed to this state. And when you can explain that it's a survival mode, and that when you try to help people to come in other states, and we could talk about ways to help people with that. I could imagine that more expression and more movement and more trying to really communicate.
You're absolutely right about these conditions that then manifest itself with how much you're able to communicate through this bottleneck, right? Yeah. This is a bottleneck. Yeah. This is if you think of us,
they can't take anything in, but also nothing will come out. So they're isolated from others and just alone. And it must be a horrible feeling.
To be heard.
To be heard.
Seen.
Yeah.
And to have agency. Yeah. So I think that when, your role as a speech language provider, with this polyvagal understanding that safety is the criteria that allows people to move into wholesomeness, which includes expressing themselves.
Yeah, absolutely.
And how can you express yourself? How can you advocate if you can't speak? Yeah. So speech is integral. It's absolutely important. Yeah. For individuals to be able to say what they need.
Yeah. So again, I can't say that enough. Safety is the treatment, and because I train others in working with this method too, for me it's really important that all those, or whenever you are a social worker or a doctor or a speech language provider or whatever, you have to know your own system, and you have to be able to stay safe in yourself, to listen with an open heart from a ventral perspective if you want, to be there and sit next to someone. And that's, in a way, this is enough sometimes.
Even that one connection, one safe connection can be the beginning
of changing of a life.
Of your whole life, and creating neural pathways of a different, more safe experience. But that requires repetition. It's not a one-shot deal, right?
Absolutely.
Consistency, repetition, presence by the provider, and faith that the individual has all the healing reflexes inside themselves. To grow and continue. I hope that the content of our interview will inspire speech language professionals, educators, and schools to look into training teachers and providers with essential knowledge of the polyvagal theory to help close the gap between learners' performance and true potential that is within them.
Absolutely. Thank you.
Thank you so much.